Hello, my name is Martin Mand and the topic that I will present you today is treatment of biological rheumatoid arthritis. As for introduction, rheumatoid arthritis is a chronic inflammatory joint disease with a prevalence of 0.24 to 1% of the population and is twice as common in women compared with men. Due to the severity and progressive nature of the disease, rheumatoid arthritis significant impact on a patient's quality of life and ability to work, and thus on healthcare costs and the economy as a whole. The earlier the age and the more the disease causes incapacity, the higher the costs. Therefore, it is important to get the disease quickly under control. About methodology, the study was conducted based on literature review and initial search of 34 articles, where 31 were excluded as not suitable for the criteria. 2 full-text articles were being analyzed. The study analyzed the effectiveness and cost-effectiveness of previously started biological treatment using a modeling method. The simulation was based on scientific literature. To assess the standard practice of biological therapy for RA, treatment data of patients receiving biological therapy were analyzed. The Drummond checklist assessed the health outcomes associated with previous biological treatment and the costs resulting from treatment and loss of work capacity. In the budget impact analysis, the impact of previously started treatment on a budget of the health insurance fund was assessed. For results, the gains made with previously initiated healthcare for RA are rather small and its size is large, but the increase in the health insurance fund's budget is not a sign of anything. Therefore, when changing the numerical limit of a synthetic disease-modifying drug, it is necessary to proceed from the treatment guidelines and the possibilities of joint health insurance. For the analysis part, the health result achieved by previously started biological treatment of rheumatoid arthritis is rather small and its cost relatively high. But the increase in the budget of the health insurance fund is not significant. Therefore, when changing the numerical limit of synthetic disease-modifying drugs, it is necessary to proceed from treatment guidelines and the possibilities of joint health insurance. For conclusion, health gain from the early onset biological therapy is relatively small and comes at an escalated economic cost. However, the budget impact is modest. The reallocation decision to support early biological treatment is driven by the treatment recommendations and public insurance capability. Thank you for listening. Goodbye.